Hi, I'm Mark Pollack. I'm Chief Medical Officer for Reunion Neuroscience. We did a study of luvesilocin, which is a 4-hydroxy-DIPT prodrug, a psychedelic, in patients with postpartum depression. Postpartum depression, as you're probably aware, is unfortunately a very common condition affecting women in the peripartum time of their life and associated with significant distress and impairment for them, but also a negative impact on the development of their offspring. It tends to be underdiagnosed and undertreated and is a area of significant unmet public health need. Luvesilocin, as I mentioned, is a prodrug of 4-hydroxy-DIPT, a psychedelic agent, which we tested in 84 patients, women with postpartum depression. These women came in, received luvesilocin, which is administered subcutaneously, and were followed over the course of 8 hours in-house, and then followed out over the next month. Patients who came into the trial were on average experiencing PPD for about 7 months. In this particular study, women could not enter if they were still breastfeeding, but we've subsequently done a lactation study and found that the transference of drug into the breast milk is very low and rapidly clears, and thus going forward, we've been cleared to further study and eventually administer this drug to women who are breastfeeding, and that's a significant benefit in this clinical population. So patients received luvesilocin, and what we found was that at a primary outcome measure of 1 week, there was significant benefit for 30 milligrams of luvesilocin, which our phase 1 data suggested was likely to be an effective and well-tolerated dose, compared to our control arm, which was 1.5 milligrams of luvesilocin, a low-dose active control. We used a low-dose active control rather than pure placebo, consistent with FDA guidance in an attempt to reduce functional unblinding, but also recognizing that it's a higher bar to match, as everybody coming into the trial received some medication. What we found was that there was significant benefit for luvesilocin at 1 week of treatment compared to the control arm, about a 5.8 difference on the MADRS, and that 70% of patients were not just better with treatment, but were in remission. The impact of treatment continued over the entire course of the 28 days of follow-up. Patients got better quickly and stayed well, durably and persistently over the entire course of the study. The drug was well tolerated. Side effects were consistent with this class of agents, and side effects that did emerge, things like GI symptoms, tended to be transient and rapidly cleared. So we were very pleased with the results of the study. We showed rapid, robust, and durable response with 30 milligrams of luvesilocin in a clearly impaired and impacted group of women with postpartum depression. This study bears and will be followed up with additional studies in postpartum depression, as well as in other mood and anxiety indications.